So managing dry eye syndrome can be very challenging, especially if you're somebody who doesn't like using eye drops or taking medications. So today I'm going to share my natural dry eye routine, the same thing that I use every single day to help manage my own dry eye symptoms. And hopefully by sharing this with you, you can incorporate some of these strategies into your lifestyle and help improve your dry eye symptoms as well. That's today's video. Let's take a look. Hey, what's up? This is Dr. Alan here from the DoctorEyeHealth Show, helping you learn all about the eyes, vision, and finding the best vision products. If you are new here to the channel and like learning about your eyes, seeing your best, then consider hitting the subscribe button down below and ring the bell so that you don't miss any of our future videos. Now today we're talking about dry eye syndrome, and I'm going to be sharing my dry eye routine, the natural dry eye treatment that I do every single day to manage my own dry eye symptoms. Now, if you're somebody who doesn't like using eye drops, you don't like medications, I think this will be the most beneficial for you. But if you're just starting out on this journey and you haven't seen our other videos on dry eye syndrome, going over the different medical aspects to dry eye, the diagnosis, and all the advanced treatments, I encourage you to check out our full video series on that. And I'll put a link to that at the top of the video description below this video so you can find it easily. But I think that's a great place for you to get resources on exactly what dry eye is and finding maybe a dry eye specialist in your area to help you with your treatment. Now, when it comes to my dry eye routine, this is what I've been doing every single day, and it has significantly helped me with my symptoms. The first thing that I do every day when I wake up is that I go drink at least 1 to 2 glasses of water. At nighttime, our bodies are processing a lot for our muscles and our organs, and so it does use a lot of water, and most of us do often wake up feeling dehydrated. So if you're naturally a person who just first turns on the coffee pot or start drinking coffee or tea right away, those are diuretics and often do basically cause our bodies to dehydrate even more. So I encourage you right now, if you're not drinking enough water, start off at least right away in the day drinking 1 to 2 glasses of water. The second thing I do is I do a warm compress. Now, I've talked about warm compresses a lot on this channel because it does help with the oil glands of the eyelids produce better oils. Now myself, I actually do warm compresses twice a day. I do 1 in the morning and then 1 at night. In the morning, I have been enjoying using a device called the TearRestore. And I've worked with TearRestore in the past, and I even have a review going over the TearRestore mask. This is a dry eye mask that allows you to keep your eyes open. So most warm compresses, you have to keep your eyelids closed, but because this one lets you keep your eyes open, with my busy lifestyle, I don't have to slow down. Usually I have about 35-40 minutes to get ready for work before I'm out the door heading to the clinic. So I need to stay productive. And so this allows me to at least put on the mask for about 10 to 12 minutes, and I'm able to, get my clothes together, get my lunch ready, anything I need to do. After doing any sort of warm compress, I do like to do an eyelid massage. After using the TearRestore, I usually am brushing my teeth, and then I can easily use what's called the NuLids Dry Eye Device. This is a special type of eyelid massager and cleaner. So if you're somebody who has bad blepharitis and irritation to your eyelids, this will clean your eyelids really good, get rid of all those dead skin cells and skin oils away from the eyes, but it also will agitate the meibomian glands in the eyelids, which essentially is doing a meibomian gland massage to encourage those glands to open up and release their content. And since you did a TearRestore or warm compress before, that makes those oils run a lot smoother, so I find that the NuLids device works even better. If you're not sure how to do an eyelid massage on your own, or if you want to learn more about the NuLids device, I have other videos going over that, and again, you'll find those links in the video description below. Now, after performing these first 3 steps, I usually do not have much for symptoms for dryness throughout the day. In some extreme situations, I'll do more blinking exercises or even use a non-preserved artificial tear. I think a lot of people, again, are trying to avoid using eye drops, but I think if you're having a really tough day, don't be afraid to use them, especially if your eye doctor recommends you do so. Now, something I also incorporate into my lifestyle is eating whole, healthy foods. This means a lot of fruits and vegetables, and then I also make sure I get omega-3s into my diet in some form. That can be through ground flaxseed in the morning with oatmeal, but it can also incorporate using different amounts of omega-3s in forms of supplements. Now, I personally take a supplement for my dry eyes called EZ Tears. There's many different supplements out there, ones that I've tried, as well as ones other healthcare professionals will recommend. Usually these supplements all incorporate some level of omega-3 fatty acid, acid, as well as vitamin D and a couple of other small nutrients just to help support the blood flow to the eye, as well as getting the oil glands to pump better. And other aspects of these vitamins are to help reduce the inflammatory load in the body, and especially on the surface of the eye, because inflammation does play a large critical role in the development of dry eye disease. You can of course look into supplements like Easy Tears, but I strongly encourage you always talk with a medical professional in your area, your eye doctor, and ask what they recommend in terms of brands, or if supplementation is even something you should be considering. Otherwise, the next steps in my dry eye routine all occur in the evening, and it revolves around taking care of my eyelids. Now, first, I clean my eyelids in the evening with a hypochlorous acid solution. There are many different brands of hypochlorous acid. It's tough for me to say really which ones are better or not, but I'll include a couple of the ones that I use down in the description below. But the hypochlorous acid solution is very safe, and it cleans your eyelids, gets rid of any of those extra skin oils, and buildup of skin cells again that contribute to what's called blepharitis, which does contribute to development of dry eye disease. So I clean my eyelids really good, I remove my contact lenses, and then right when I'm heading to bed, I like to use another warm compress. Now, I actually use what's called an Eye Eco product, which is either the Tranquilize XL, the Tranquilize Cloud, or even the Tranquilize Vibes. I've used all three of these, and I think they work great. Now, I use the Tranquilize or the Eye Eco products in the evening because I find them more effective than something just like the TearRestore. The TearRestore is great because your eyes are open and lets you stay productive in the early mornings, but at nighttime, I find the Tranquilize Eye Eco products just do a lot better job. And they do this because the Eye Eco products not just activate heat for 10 minutes, but they hold their heat for at least 20 to 25 minutes, depending on the product. But they also don't just give dry heat, but they give moist heat. So they actually help trap the right amount of humidity around the eyelids and holds it there for that full treatment period. And this extra level of humidity and moisture is really important for helping stabilize the salt content of your tears, which we call your tear osmolarity. Now, I've talked about a lot of different warm compresses on the market, anywhere from the TearRestore to the Eye Eco to the Brooder masks. There's, again, many different ways out there. This is just what I personally use and find to be most effective. I would say most nights I'm either using the Tranquilize XL or the Tranquilize Cloud because they're just very comfortable to wear. I can close my eyes, and to be honest, a lot of the times I'll even fall asleep with these on, and I'll wake up either in the middle of the night or the next morning, and I'll find the Tranquilize warm compress like somewhere near me. I do use the Tranquilize Vibes quite a bit, especially if I'm just having a harder time falling asleep, feeling more rested. The Tranquilize Vibes also vibrates. It plugs in and vibrates to help get your oil glands pumping again. That one I really do like. However, it's something you have to pay attention to because it doesn't just shut off on its own. Otherwise, it's kind of a way to get both the warm compress and the eyelid massage all happening all at once. But I'm a firm believer that doing this type of a warm compress at nighttime significantly improves my dry eye symptoms, especially throughout the night, and then certainly when I wake up in the morning. And then again the next morning, I basically hit the repeat button and start all over again. Now, the key important thing for having success for dry eyes is not just doing a few of these once or twice, but it's doing them consistently every single day. I know for a lot of my patients and for a lot of other eye doctors out there, we know that a lot of people will start taking some advice or recommendations that we give them, but then they just don't utilize it. Maybe they'll try it once or twice, they'll do a warm compress for like a week, and then they kind of forget about it and becomes kind of set off to the side somewhere. This is something you need to really learn and incorporate into your daily lifestyle. That way you're gonna have the most success with it with any of these strategies. I even had one of my patients who got something like the NuLids device and only used it a few times and then returned it because they found it wasn't helping. Well, the NuLids device takes at least 30 days of doing it every single day to have a clinical benefit, and they've shown that in studies. And you can really say that about any form of treatment for dry eyes, because I think with dry eyes, it's almost impossible to fully cure it. It's really just something that you manage, kind of like arthritis. It never goes away, but it's something that you have to manage to keep it at bay, and occasionally it may flare up, and then something more advanced, like maybe medications or an in-office procedure may be really more important. But I do want to pass this off to you. What other techniques or strategies are you using in your daily dry eye routine routine that are really helping you. Go ahead and share those in the comment section, because I know other people who are watching this may be curious what has been helping other people. Is there something that they haven't tried? Again, leave those comments in the section below, because I really want this to be a resource for everybody. Otherwise, I hope you enjoyed this video. If you did get value out of it, hit the like button for me, because that's gonna let the whole YouTube algorithm know that you value this content, and by your help, you're gonna help make this channel reach more people, and it's gonna help people around the world learn more about their dry eyes and their eye health. Again, thanks for watching, and if you want to learn more about the diagnosis of dry eye and the different treatments that are out there, check out the full series by clicking and tapping the screen right over here to the side. Or if you want to learn more about different things about eye care, things like contact lenses for dry eyes or something, go ahead and click or tap the screen down over here. Again, this is Dr. Allen from Dr. Eye Health. Keep an eye on it, and we'll talk to you soon.